Welcome everyone, and thank you for joining us today. My name is Katherine Gibson, and I am the Allergy Lab Technician at the Hotze Health and Wellness Center. A little later, we will hear from Heather Seamall, a registered nurse at the Hotze Health and Wellness Center. Today, we are discussing food and airborne allergies, the symptoms they can cause, as well as what you can do to control the allergens in your child's environment as much as possible. I have 3 children of my own and have witnessed the effects that allergies can have on their tiny immune systems. So my goal today is to give you as much information as possible so you are equipped to improve their quality of life. At the end of our presentation, we will be taking questions, so please enter them into the chat box as we go along. First, let's discuss food allergies. Food allergies are very common in children, and oftentimes the symptoms go unnoticed or they're thought to be caused by something other than food. So common food allergies are fatigue, ear infections, headaches or migraines, postnasal drip, cough, clearing of throat, behavioral issues, or mood changes. In particular, with the ear infections and behavioral issues, oftentimes food allergies are not the first thing that comes to mind if your child experiences those particular symptoms. I know when my son was an infant, he had recurring ear infections every month, and the pediatrician would simply prescribe antibiotic after antibiotic, and it just wasn't helping. It wasn't until I discovered that milk was actually the culprit. That's when my husband and I switched him to soy formula, and the ear infections actually resolved. So it's very interesting the effects that food can have on children. We have 2 types of food allergies, fixed and cyclic. A fixed food allergy might be very apparent to an individual. For example, if someone has a peanut allergy and then they eat peanuts, they could have an immediate reaction like lip or tongue swelling, and so this would be considered a fixed food allergy. Now, unfortunately, there is no cure for fixed allergies, so complete avoidance is the only solution. A cyclic food allergy is a little more difficult to recognize because it can sometimes have a delayed reaction that takes up to or more than 24 hours to present itself. In addition, the symptoms can vary tremendously, which makes it very difficult to determine exactly which symptom is caused by which food. So what can you do to alleviate some of your child's food allergy symptoms? First, try to determine which foods are causing your child's symptoms. I suggest keeping a food diary that monitors what is consumed during breakfast, lunch, and dinner, but also any snacks eaten throughout the day. Keep track of the foods, vitamins, and medications, if any, the times that they were consumed, and any symptoms experienced throughout the day, particularly noting the times the symptoms presented themselves. I'd also recommend communicating with your child's teacher if they're in school so that you can monitor and document any behavioral issues they may have had throughout the day when you weren't present. Now, this is very important because many teachers are not aware of the behavioral issues that can be caused by food allergies. If the communication between the parent and teacher is strong, then hopefully some children can be spared from being placed on pharmaceutical drugs that might not be necessary. I've seen firsthand a quiet, content young boy turn very defiant and unruly simply because he was having a reaction to corn. So it was really quite amazing to watch. Of course, this was done in a controlled testing situation, but it has really opened my eyes to the significance of food allergies in children. So once you determine the foods that cause your child's symptoms, you must eliminate them for a short period and then challenge them to see if in fact they do cause symptoms. If they do, the foods will need to be eliminated. We suggest 10 to 12 weeks, and then you would reintroduce them. An important thing to remember is that overexposure to a particular food can cause food sensitivities to develop. So to try to avoid this, it's recommended to eat foods on a rotation diet every 4 days. So for example, if you were to eat chicken on Monday, you wouldn't want to eat it again until Friday. So now we will move on to inhalant allergies. Common symptoms include a host of different things. We have sneezing, runny nose, itchy, watery eyes, congestion, fatigue, headaches or migraines, eczema or other skin problems such as rashes and hives, dark circles under the eyes, sore throat, asthma, of course, depressed moods, sinus pressure, postnasal drip, and cough. So what time of year does allergy season begin and end? Well, it really lasts all year long. A common misconception is that we have 1 or 2 allergy seasons to worry about during the year, when really inhalant allergens are present all the time. We literally jump from one allergy season to the next, beginning in January and going through December, only to start the process over again the next year. So this can be extremely miserable for children suffering with symptoms all year round. Some tips to help you relieve your child's allergy symptoms are, we have some natural approaches. Vitamin C is a natural antihistamine. This isn't going to cause the drowsiness and the grogginess that some of the over-the-counter antihistamines can cause. Neti pots are another good tool that can be used on individuals over the age of 5. Neti pot use decreases inflammation and cleanses the nasal passages. So next we have some tips about pollen control. Common symptoms are going to be itchy eyes, runny or stuffy nose. Pollen counts are the highest outdoors between 5 to 11 a.m. Counts will be worse on dry, hot, and windy days. And pollen counts increase after rain. So what can you do? Definitely keep the windows and doors closed. I know it can be very tempting to allow fresh air into your home when it's nice and sunny outside. But for allergy sufferers, it can really be the difference between a good or bad day. Use your air conditioning. Keep your pets outside or bathe them often. What will happen is pollen will attach to their coat, and if they're inside pets, they'll spread pollen all around your house, making it even more difficult to control your child's environment. Next, we have shower after coming in from outside. I'm sure we've all seen pollen on the outside of our cars at one point, and really our children are no different. They must bathe after playing outside, and certainly before going to bed. Otherwise, they too could be carrying pollen all around the house without even knowing it. Also, children can have pollen in their hair, so when they lay down at night, the pollen gets transferred to their pillow and they sleep directly on it all night. So if it seems your child's allergies symptoms are worse upon wakening, this could definitely be the reason. And lastly, avoid or limit outdoor activities as much as possible. Moving on to mold spores. Mold spores require warmth and moisture to grow. Mold spores are worse outdoors from 5:30 to 8 p.m. They are worse in warm, damp places, and also when mowing the lawn or during any kind of yard work. Symptoms can peak in the summer, but can definitely occur all year round. Their greatest prevalence is in damp, shady areas, decaying leaves and vegetables. And highest counts are going to be higher in humid weather. So what can you do? Decrease the vegetation around your house. Definitely remove any overgrown shrubs. Drain any of the low-lying areas you might have around your home. Use a HEPA filtration system in the whole house if possible, but certainly in your child's bedroom if that is your only option. And keep your humidity below 40%. Next, we have animal dander. It's almost impossible to avoid exposure to cat or dog dander because the allergenic particles are 1/10 the size of dust mites, which is extremely tiny, and the sticky dander will even be carried on clothes. So even though you might not have any pets yourself, think of all the people your child comes in contact with that do have exposure to animal dander. What can you do? Now, I know this isn't going to be a popular choice, but if you have a dog or cat, you could always remove it from the home. It can take approximately 20 weeks to decrease the dander level after removal, and cat dander can actually take years. If removing the animal from your home is not an option for your family, at least keep the dog or cat outdoors and definitely out of your child's bedroom. Wash your animal weekly, and again, use a HEPA filtration system if possible. Next, we have dust and dust mite control. Common symptoms for this is runny or stuffy nose and possible itchy eyes. Dust mites are going to be worse indoors, and symptoms will worsen after going to bed and upon waking up. Symptoms are aggravated, of course, by dusting and sweeping, And mites thrive with heat and humidity. So any environment with temperatures of 65 to 84 degrees Fahrenheit or 60 to 80 degrees humidity is going to provide perfect breeding grounds for dust mites. Their favorable habitats include the mattress, couch, carpet, bedding, and pillows. So what can you do? Definitely wash your child's bedding in hot water weekly. Remove carpet and or upholstered chairs if possible. Replace draperies with blinds. Basically anything around the house that will catch and hold on to dust, you want to remove it if possible. Again, keep the pets out of the bedroom, vacuum frequently, and use HEPA filtration system if possible. So now that we've covered all of the imposing airborne allergens, let's look at the benefits of using sublingual drops versus injections. First and foremost, we all know that injections are painful, particularly for children. Oftentimes, they must be administered at the doctor's office, which causes you to miss work and your child to miss school. And there's typically a waiting period after the allergy injection just to ensure that there's a positive response. Now, at the Hotze Health and Wellness Center, we use sublingual drop therapy, which is safe, effective, convenient, and most of all, it's pain-free. The drops can be administered at home by either a parent or the child. Our approach to treating airborne allergies is a little different than conventional methods. Most doctors are going to test patients to see what they're allergic to, and our approach simply analyzes your child's blood, which gives us a recipe for creating a customized dose of allergy drops that your child's body can specifically tolerate. Our goal is to build good blocking antibodies so that when your child is exposed to the allergens, their immune system will block any kind of allergy reaction from happening. So essentially, the sublingual drops work like an immunization would. Our testing panel contains about 40 different allergens, including everything we've already discussed: grass and tree pollens, dust mites, mold spores, and animal dander. Your child will simply place a specified number of drops under their tongue daily, and by doing so, it will improve their quality of life by allowing them the freedom to play outdoors without being restricted by naturally occurring allergens in the air. Now we will hear from Heather, a registered nurse at the Hotze Health and Wellness Center. She is going to tell us a little bit more about some children's supplements available to help control allergies and promote overall good health. She will also announce the special offer we have for our webinar attendees today.
Hi, thank you, Catherine. Yes, we do have a couple of supplements that we do recommend for our kids' immune systems to try to keep them healthy and also help to combat their allergies. We do have specifically designed vitamins for tiny immune systems, growing bodies, and healthy brain development. These are created for any kiddos ages 3 and up. They are free of allergens, sugars, chemicals, dyes, and fillers, so they're just really great multivitamins and supplements for them. The first is the NutriKids. It's a great tasting sugar-free multivitamin. It's loaded with key vitamins and minerals that are essential to growth and development in children. It does contain immune-boosting vitamins such as B complex, vitamin C, D, and zinc.
I think we might be having some technical difficulties. We're good.
Can you hear me?
Yes.
Okay, so, and then the second one is vitamin C, which is a great tasting chewable vitamin as well. Vitamin C is a natural antihistamine in the system. It does potentiate white blood cells, which can help fight infections, which also, because it's a natural antihistamine, it is going to be one of the best things for allergies. It does help to support the adrenal glands and, of course, the immune system support. And then last is the Nordic Naturals DHA Junior. It's a pharmaceutical-grade fish oil, which is really rich in those omega-3 DHAs. It's strawberry flavored, so for kids it's really easy to swallow. They can chew it as well if they're over 3. It's essential for proper development of brain, eyes, nervous system, and immune system functions. It does help improve mood, memory, and concentration. We do typically recommend any kind of fish oil, especially this one, for any of our kiddos who might be or might have been told that they're suffering with any kind of mood disorders such as ADD, ADHD, anything like that. It really is really good for concentration. In physician's preference, through purchasing any or all of these supplements, you will receive an additional 10% off orders. Just make sure that you use that code KIDSWEB now through Friday the 26th.
Okay, so now we will take some time to answer some of your questions. Okay, the first question is, my child always has a runny nose and dark circles under her eyes. Could this be allergies? Heather, go ahead.
Absolutely. Allergies, especially in kids, runny nose, dark circles under their eyes, you feel like you see them itching their nose a lot. Those are really common allergy symptoms for kids that are very much treatable with our sublingual allergy therapy.
Okay. The next question we have is, in a parent-teacher conference, the teacher told me my child may be suffering from ADD or ADHD. Is this an allergy issue? I would say absolutely. And it goes back to what I said about keeping a food diary to monitor what it is they are consuming throughout the day, and then monitoring any symptoms, whether they're behavioral or not, and trying to pinpoint which food, is there a pattern, is there a symptom that they are having every time they eat eggs or every time they drink milk. Just keep track of that, and you can pretty much determine a pattern yourself. Okay, the next question, at what age do children outgrow allergies? Really, you can, I've seen where you can have an allergy to a particular food as a child, or even an airborne allergy for that matter. And then as you age, you notice that all of a sudden that doesn't bother you. And so it kind of goes back to, there are no absolutes in allergies. What may have bothered you when you were young, you could grow out of, and then vice versa. We used to have a person work here that absolutely loved strawberries, grew up on them, and then in her adult stage, she couldn't eat them. They caused her to have an anaphylactic reaction. So I wouldn't say that children outgrow allergies. It's just a matter of their particular immune system and the environment around them. Next question is, from this presentation, I understand that food allergies can only be dealt with by avoidance. Is that correct? Well, it's the fixed food allergies that there is no cure for it. They must be avoided if you don't, want to experience those symptoms. We do have, or there are therapies that are out there to address food allergies. There are such things as neutralizing drops that you can be tested for particular foods, and then the neutralizing drops can help either stop you from having a reaction if you've already eaten that food, or you can take it at the beginning of the day and it'll prevent you from having a reaction. So, for, again, fixed food allergies, there's not going to be a cure for that, but there are some other methods out there that can help you deal with the food allergy symptoms you might be experiencing.
I do agree with that, and the one thing that I would just want to add to that question would be there's a difference between allergies and there's a difference between like a sensitivity, like a fixed food allergy, you're talking like peanut allergy, things that may cause a life-threatening reaction. Absolutely, it is very important to avoid those foods and even possibly carry like an EpiPen just in case they were to come in contact with any of those foods. For things that are more of a cyclical food allergy, and you may even want to call it more of a sensitivity to that food, you can, once it's determined through whatever measure of testing that's performed, you can go and do a rotational diet. Each program is a little bit different, but there is a way to be able to avoid the food for a particular amount of time and then possibly even rotate it back into the system after whatever length of time that is so that it isn't causing the negative symptoms. But our immune systems are designed to where if you were to ingest any particular food, repetitively, whether it's egg, corn, wheat, chicken. If you were to ingest that food every day for a certain amount of time, eventually your body just becomes sensitive to that food. And so by doing a avoidance and rotational diet for the foods, you can hopefully eliminate those sensitivities that those foods can cause.
Next question is, how old do you recommend children to be to start sublingual drops? Now, Heather, I think the youngest child we've seen is age 2. Is that right?
Right. They just need to be able to understand that the drops need to go underneath the tongue. They don't have to be able to administer themselves. You can help them with that, but as long as they understand underneath the tongue to administer them, then we can go ahead and get them tested and on drops.
Next question, how long does one usually have to continue using the sublingual immunotherapy once they begin it? Now, our goal here at the center, we would like you to take the airborne sublingual drops every day consistently for at least 2 years. That first year, the drops will help you build up those good blocking antibodies. And then that second year, we want to make sure you can get through all 4 seasons without any problems. Now, after you've been on treatment for 2 years, you can definitely back off the dosage and not take it daily, but you would still want to take, at least drops a few times a week, just to make sure that you're still getting that exposure to the sublingual therapy, and that your antibodies are still, staying strong and your immune system is staying strong.
Exactly. The only thing with allergies is that, unfortunately, unless you were to completely change environments, move out of whatever it is that you're allergic to, especially when you're talking about airborne allergies, there's no cure for allergies. So if you were to get on our drops and your immune system is built up and working really well, eventually if you were to completely stop therapy over time, your body does kind of build up those bad antibodies again and you start to suffer from the same symptoms.
Okay, the next question is, it says, I notice more kids being prescribed antihistamines, steroid nose sprays, and Singulair for allergy symptoms. It seems like these meds don't totally get rid of the symptoms. Will your drops get rid of most of their symptoms? I'm sure they would do it without all the side effects from these prescribed medications, correct? Absolutely. What a lot of the over-the-counter antihistamines and allergy medications do, they're really just masking the symptoms. They're not addressing the root problem. And the root problem is simply that, your immune system is weak. You have antibodies to the offending allergens in the air. And so what our drops do is it goes to the root source. It helps your immune system build those good blocking antibodies. I've not heard of any side effects from the drops. And, I work in the allergy lab and I take those calls and all of that. So there's not side effects. A lot of with the Benadryl and things like that, they will cause you to they have the grogginess, they cause you to be drowsy. And really, in adults, but specifically children, they just can't focus or, make it through the day at school when they're on these medications. So ours is definitely a natural approach, and it will not have those same side effects. And, like I said, we're also addressing the root cause of the problem and not just masking the symptoms.
And the other thing that I would just add too is not just for allergy sufferers when we're talking about any prescribed antihistamines or steroids or whatnot, but also taking it one step further to asthma. Allergies and inflammation is kind of the root cause of a lot of asthma cases as well. So while we can also work on getting them off of their antihistamines, their steroids, their nasal medications. For those kids that suffer with asthma, we can also try to get them off of their asthma medications as well.
Now, Heather, we have a question here. It says, what is the oldest age kids could use these vitamins, the multivitamin, vitamin C, and fish oil that you showed? Did you say what the oldest age was?
I didn't. I would say that I would say 3 to probably 12 to 15. It may depend on weight as well. If you have specific questions on that, I would contact physician's preference. They would know for sure at what age that maybe we would switch them over to our adult packs. But I would say probably anywhere between 12 and 15.
Next question is, where can we find good resources on how to implement a rotational diet for preventing food sensitivities? This is a great question, and actually we are going to get some resources up on our website, so you'll be able to visit hwc.com, and we will post some resources there for you. Next question is, what is in your drops? We have a panel of about 40 different allergens, and it just ranges from grass pollens, tree pollens, dust mites, mold spores, and animal dander. It's a pretty broad list, and it covers people, all around the United States. And what's nice is that if we treat you for a particular grass or tree that's in our mix that might not be prominent wherever you live, they are cross-reactive, and they can still, by treating one, you're basically treating everything in that family. So again, it's about 40 different allergens. Next question, are the drops administered once a day or more? We would prefer the recommended dose is to take 3 drops daily. Now, if you can split that dosage up into 3 parts, so take 1 drop in the morning, 1 at noon, and 1 in the evening, you'll notice that the drops work, they'll be more effective for you quicker. But regardless, sometimes people miss that midday dosage, and we just want to make sure that you get 3 drops a day. So if that's all in the morning, that's fine. If it's in the evening, that's fine as well. Okay, so we are going to go ahead and wrap things up. So we've learned today that children are constantly exposed to allergens in the environment on a daily basis all year round. The good news is the Hotze Health and Wellness Center has a safe, convenient, pain-free solution to alleviate your child's symptoms and get their health back on track. So if you suspect your child suffers from allergies, please visit our website at hotzehwc.com to complete our Test Your Health questionnaire, or you can give us a call at 281-698-8698. Just remember that allergies are very tricky. There are no absolutes. Like I said earlier, as people age, they might not experience symptoms they once used to. And the same is true on the other side. People age and suddenly develop allergies to things they could once tolerate. The key is to take charge of your health and pay attention to what your body tells you. Thank you for joining us.